2 of Ask the Dietitian for the month of November. We had a popular topic, and our participants asked so many questions that I couldn't possibly address them all in one single session. So here we are for part 2. If you missed the first showing or the first episode, we record most everything. Just go to our YouTube channel, check out Cancer Wellness Center, subscribe. You'll see lots of fun content on there. And if you can't make it in person, at least you can see it recorded. We do encourage you to sign up for as many programs as you can, especially mine, because if you sign up, then you get your hands on the content, right? So we'll send to you the PowerPoint slides. Sometimes I send other resources. Sometimes there's recipes. Almost always there's recipes. So if you're interested in that type of content, it's important also too to sign up. Okay. So great to see you all. I'm going to get started. This should not take as long as usual. Because we're just answering the remaining questions from part 1. So our topic for the month of November, thank you for joining us. If you're on Facebook, welcome. Thank you for being here. Our topic was prebiotics and probiotics. I shared that it was, and that's the wrong date. I apologize for that. It is the 22nd of November. This is one of my favorite topics, like gut health, gut microbiome. There's not a lot that we know about it. And that's what I'm going to share with you today. You know, there's a lot of great questions that are being asked, and you all as the audience and the people that I work with ask some really great questions. And I think it's just a matter of time before we know how to answer them in a way that's more impactful, right? In a way that we'll see some differences and significant benefits to clinical outcomes. Okay, so stay tuned, and maybe there'll be future Ask the Dietitians as we learn more. Okay, so what I'm going to do is just list those questions again, offer some answers to the best of my ability, offer some resources at the end, and then our participants that sign up get the recipes that I thought would be appropriate to apply this information for a cancer protective diet. So here are the remaining questions. There's just a few. What are the best ways to recover gut health after a colonoscopy? Are gut microbiome tests to know my unique probiotic needs reliable? This was my favorite question, hands down, probably of all time. I'm so glad that someone asked this question. I'm hopeful that I can answer it in a way that is meaningful and helpful. And then lastly, I heard that the oral microbiome affects gut health. Can you share your thoughts on it and taking probiotic lozenges like BioGaia? All really great questions. Okay, so before we really get into those, I just want to quickly overview what are pre and probiotics. So prebiotics were first, they're sort of new to the family of the two. So prebiotics were first defined in 2016, not too long ago, by an expert panel as a substrate that is selectively utilized by host microorganisms conferring a health benefit. All this really to say that they are food for the microbes that live in and on us. Kind of fun, right? They need food too. So they're present both naturally or in synthesized forms, and very often there's products on the market that have them added to foods, and that's where Dietitian can help you find ones and ones that might be overall a healthful package because of those added prebiotics. Research suggests that there's several benefits to including probiotics. I'm just listing a handful. They benefit our metabolic health, including diabetes and blood sugar control, dyslipidemia, and metabolic syndrome. They improve the absorption of some of our vitamins and minerals, including calcium, and that's going to in turn support our bone health. They've been shown to be beneficial in inflammatory bowel disease, so that's Crohn's, and then ulcerative colitis. And then they're also helpful for a lot of other GI conditions like IBS, traveler's diarrhea, constipation, and so on and so forth. There's a lot more, right? There's a lot more to discover about prebiotics, I'm sure, too, and time will tell. Now, probiotics have been around a little bit longer. We've known about them since 2001. They were finally defined as being live microorganisms that, when administered in adequate amounts, confer a health benefit on the host. We have to define them, because if we don't define them, if something doesn't fit that definition, it's not considered a probiotic. And that's sort of important in terms of clinical applications, right? So for example, like if we eat a food that has probiotics in it, but it doesn't fit this definition, like for example, if we have some tempeh, which is a fermented soybean, once it's fermented, yeah, it has some probiotics in it, but then when we cook it, they might not fit this definition, right? They might not be live by the time we ingest them, and they might not be in the adequate amount that we need them to be in. And so I'm just using that as an example, right? Because I think there's a lot of confusion about what pre and probiotics are. So we want to look always towards that definition. Probiotics are present in many foods, and they're also available as supplements, but only the strains that have been characterized in research with a scientifically demonstrated effect on health can be technically called a probiotic. They're known by their genus, their species, and their strains. So, for example, Lactobacillus acidophilus, ABC. The dose matters. Don't always assume the more the better. I think that's sort of an American societal belief, right? If something's good, then a lot must be really good. It's just we need a specific dose. And so it's not like the more the better. Available evidence, according to decades of research, so that's a lot. That's a lot of studies, suggests that there's health benefits, mostly to GI conditions. I think that's no surprise there. So how they actually work is still an active area of research. In some cases, the mechanism of action for probiotics are challenging, and they may not really know exactly how they benefit us, but we know there's a benefit somehow. They suspect that there's multiple mechanisms that may elicit a health benefit. A common misconception is that probiotics need to alter the gut microbiota to be effective, and that's not the case. They don't really take up permanent residence. They're just there. They sort of act like the other beneficial microbes, and then they leave. So it's really interesting, I think, to learn all of this. The strongest level of evidence in terms of the benefits of probiotics, as I shared, are in our GI conditions. So IBD, IBS, antibiotic-associated diarrhea, infectious diarrhea, constipation, and then as an adjunct to standard treatment for H. pylori. There's also some emerging evidence that probiotics may be beneficial for other conditions like obesity as well as mood disorders. So stay tuned. I think it's really exciting. Here is sort of like a summary. So for the participants, this is like, you can talk about this at Thanksgiving, right? Like, I know what prebiotics are. I can define them. I know I can find them in certain foods, but then there's also functional forms of them like GOS, FOS, TOS, inulin, chicory root, and what are the benefits? And same goes with probiotics. So that's just a summary of the information that I shared. All right, let's get to those questions. So what are the best ways to recover gut health after a colonoscopy? There is a consensus opinion that large bowel prep disrupts the microbiome, but we don't really know if this disruption has any detrimental effects or any long-term implications. That hasn't been researched according to my review. I didn't come across anything. However, what they think is that there's a relatively quick recovery after this large bowel prep, and it takes a couple weeks. If for some reason you wanted to, maybe you're getting that colonoscopy for a reason, and maybe you're involved in a research study and they want to evaluate your microbiota, you might just want to consider that, like, my microbiota has been disrupted because I just had bowel prep, right? So I want to give it more than 2 weeks to evaluate. I'm just throwing that out there. I think that's a very rare circumstance. We don't know what is really disrupted, right? We have no idea. We don't even really know if that disruption is a problem. So I think the best takeaway from all of this is that, yeah, it probably is disrupted. And maybe during that 2 weeks, it wouldn't hurt to like ramp up the food forms of both pre and post and probiotics, right? So maybe you only have a yogurt once or twice a week, but maybe you'll have one every day. Or maybe you make a smoothie every day, but instead you're going to put some kefir in your smoothie, just to sort of help facilitate the recovery of the disruption of microbiota. And especially because that's a low risk intervention, right? That's not going to cause you any harm. There's no evidence to give you any information about taking a probiotic, right? So in turning to food is always a really safe bet. And chances are you might open up some opportunities to like really make some healthful foods that way, and think about how our total health can benefit from that. But specifically with our gut, if you make, for example, a yogurt or a kefir-based smoothie and added some banana and some oats, now you're adding some prebiotics. So you're making this like all-encompassing gut-friendly smoothie, right? And I think that would be a great way to approach this, and then maybe it would be an option for you moving forward. So hopefully you find that helpful. Okay, so one of my favorite questions of all time. Are gut microbiome tests to know my unique probiotic needs reliable? Great question. All right, these tests, these so-called tests, they're still in their infancy, right? They're direct to consumer tests. It's not like your doctor tells you, I want you to take this microbiome test. You'll go give me a stool sample, we're going to collect it, we're going to talk about it as your gastroenterologist, and we're going to talk about what those results mean, right? We're buying these tests from someone who's selling them, right? So who do we know even who they are? But we're buying them, and we're going to collect our stool and send it off. Scientists have not been able to define a single healthy gut microbiome profile. I don't know, maybe we will, I guess we will at some point, but we have no idea what that looks like. So knowing that, no matter what our test results are, what are we looking for here, right? And I want you to keep that in mind as I continue to explain that. So without knowing what a desirable microbiome looks like, or what our desirable microbiome might want to look like, we have no way of knowing, right, what the answers to some tests are going to say, right? It's just not very helpful information. So the other issue is that stool samples do not accurately or reliably measure what's happening in terms of the microbiome, right? You're collecting the stool. You're not collecting what's happening in the environment in the gut, right? And especially at the level of the intestinal mucosa, which is the lining of the gut. That's like a busy, active environment. And it's not like you're taking samples from there, right? You're taking the stool, it's just happened to pass through. So it's not measuring, it's like comparing apples to oranges, right? You're not measuring the two. Also, and this is my biggest criticism, because I just think it's not really fair that I see this happening a lot, and especially on social media. You'll see that there's a label of good versus bad bacteria. And I don't think that's fair, because bacteria is behaving a different way inside its own environment, and how it doesn't interact with other species. It gets very, very complicated. So just because there's some assumptions and theories being made in research, that doesn't necessarily mean we can collectively take a sample from our stool and say, like, these are good, these are bad, and how much of them you have. It just gets way too complicated. And I don't even know if I'm explaining that well, but hopefully you are following. And a good example of that is that some people actually are asymptomatic colonizers of the potential pathogen C. diff. You may have heard of that. So some of us might carry that, and it's not a problem at all. It doesn't cause any problems for us, right? While other people, it causes a pretty nasty infection, a nasty recurring infection that requires treatment. So we just don't know enough, really, is the bottom line here. Now, oops, that's backwards, sorry. So 20%, this is also really helpful, important information. 20% of the gene sequences have not been identified, and 40% of the 10 million microbial genes have uncharacterized functions. So meaning to say, we just are not there yet. So let's start with that first little bit of information. 20% of gene sequences. Oh, it's like a tongue twister. So the microbiota, the microbes that we have, are one thing, but they have their own genes, and their genes influence their activity and also influence us. So we don't even know what's going on 20% of the time, right? So we still have a little bit more work to do to understanding this. Also, 40% of the 10 million microbial genes have uncharacterized functions. So they're doing something, but we don't really know what that is. So I think great that we're starting to learn, and maybe there's a little bit more time and we will know more, but we just are not there yet. And that's why that first line in trying to answer this question is that we're in its infancy. We just can't test our microbiome yet. So the tests that we're using, they're just based on microbe isolation. It's not giving us really a lot of helpful information, right? Hopefully you're starting to see that. If a microbe grows easily in a test setting, it doesn't mean that it's the most abundant or important in the fecal samples. right? So there's all these flaws in this way of testing. It's not really very accurate. Culture-based tests are inaccurate by design because they favor oxygen-loving bacteria, and most oxygen-loving bacteria are pathogenic. So I think that's where it's a coincidence that some of these microbiome tests might be kind of exploiting this mechanism here and saying, hey, your stool samples came back, you have some of these pathogenic microbes, but they grew very well because they were in an oxygen-loving environment. And that's not really truly representative of what's happening in your gut. Kind of unfair, right? So another point to make is that the bacteria that grow without oxygen at all, those are anaerobic, they're not being measured. So are we really getting a true picture here with these microbiome tests? Researchers use sophisticated techniques that measure metabolic products of the microbiome, not just like what those microbes are, but they are measuring what those microbes are yielding in terms of when they metabolize food and what their functions are. And so they use stool, they also use serum, and they use these metabolomic methods. I'm butchering that word, I'm so sorry. Metabolomic. I finally got it. So the direct to consumer testing are not using what these sophisticated techniques are in research studies. Okay, we don't have enough money to do that. So the vast majority of the metabolites still remains unknown. And again, that's why they're measuring them, they're looking at them, they're researching them. This is a very busy, active area of research. Experts summarize that the existing tests for microbiomes, they use different techniques. They focus only on taxonomy. So that's what I was sharing earlier. They're only measuring what microbes come out, and they're only really measuring the ones that love to grow around and with oxygen in their environment. So we don't know what about the other ones that don't love oxygen. We don't know how they're behaving. We don't know about their gene sequences. So all we're getting is a label of this is the type of microbes that you have in your gut. That's not helpful information. That's not enough information. We need to know more, right? So only knowing what you have based on those kind of flawed techniques really doesn't give us any diagnostic, or it's not prognostic in terms of, okay, if we do this, here's going to be your outcome. Right? So again, not very helpful, not very useful. The tests do not offer any information about a medical diagnosis or how to treat an unbalanced microbiome. If it does, then that's your red flag that there's probably something really wrong with this testing company. And that's really inappropriate and unethical and should not be followed. And I would just maybe explore this with your gastroenterologist or a second opinion if you're not satisfied with that. The microbiome is dynamic, it changes frequently, right? And I think this is kind of hitting the nail on the head. So when you measure a stool sample, you're measuring a point in time. And we don't really know if that's changing. It probably is, right? So are you going to continuously capture that and send that off to the company? Maybe, I guess I don't really know enough about these microbiome tests, but I'm going to guess they are not measuring stool samples that way. Pilot studies are actually looking into microbial signatures, as they call them, in order to predict response to treatment in IBD or for colorectal cancer screening. Really exciting. All right, these are pilot studies. So those are like the very preliminary start of research. And they're only now just looking at this. So it's going to be time before we build and collect more information. So it's sort of like, and maybe some of you are aware of this, sometimes with genetics, we look at whether or not someone will respond to a medical intervention like a prescription drug. And so it's exciting that maybe now we're kind of leveraging that type of information and applying it to the gut to see if there will be an individualized response to some of our treatments. Really cool. So stay tuned for that. And I promise I'll share when I know more. All right. So hopefully, the bottom line that really these microbiome tests are not necessarily the way to go. Sounds exciting. Maybe it's good information to know, but I would not go beyond that. I wouldn't trust that the information is suggesting you have a good or bad gut health. If you want to explore that more, ask your gastroenterologist. work with a dietitian, and maybe there are ways to kind of explore that to see if you make some changes. But otherwise, these microbiome tests are not really giving us any helpful information. There are some, what I would call potential harms to them, the cost, right? How much do they cost you? And so having this information that's not going to really help you make any kind of decisions about your medical care, is it worth just having it without doing anything about it? Maybe. That's your call. If you do sense something is going on and something's wrong and you don't visit, a healthcare provider to evaluate that, that concerns me, right? So if there's any delay, and that's what some of the critics of microbiome tests say, that it might cause someone to delay proper care. So bottom line, researchers especially who are doing this, as their livelihood, they're calling for improved regulation of some of these direct to consumer testing services because they think they're doing a disservice. And I tend to agree. If you want to know more, and if you want to share a very specific test that you've maybe seen or want to try, and you want to work with me one-on-one, I'd be happy to explore that with you and give you more specific advice. But for the general audience for today, these microbiome tests seem to be a big no-no. Okay. So last question. So I heard that oral microbiome affects gut health. Can you share your thoughts on it? And taking probiotic lozenges like BioGaia. We're naming names, huh? So the oral microbiome is the community of microbes that live in our oral cavity. It's the second largest one after our gut. Our understanding of the relationship between the oral microbiome and disease is evolving. So again, it's still like just a matter of time before we learn more. But we do think that the mouth and the gut are connected in terms of the microbiomes and if they're talking to each other as well. If we have changes to our oral microbiome, it has been shown to be linked with other conditions. I feel like we might have known this for a while, but now they're starting to actually, confirm that. So for example, if someone has gum disease, that's linked with the increased risk for inflammatory bowel disease as well as colorectal cancer. Really fascinating, right? So our dental providers really want to make sure we're getting proper care with them. So other possible associations are atherosclerosis, heart disease. I think that's the one we've known about for some time. Rheumatoid arthritis and Alzheimer's disease. So really exciting. And, maybe there's a relationship here between the two, but there's no clinical utility with knowing and, what do we do about this information, right? What's the oral microbiome need to be in order to help maybe lower our risk for some of these conditions? We don't know, but because there's a link established, maybe some information is forthcoming and we'll know soon. Now about BioGaia, it's a lozenge, as the question asked, but there are some other products by BioGaia, like liquid drops and some chewables. According to one of my favorite resources that I'm going to share at the end, the panels has found that there's a level 1 amount of evidence, which that's the strongest level available. It supports this product for oral health, so in reducing tonsillitis, laryngitis, and dental caries. Cool. So if that's something that you're concerned about or have as an active condition or maybe a recurring condition, maybe you want to think about using them or asking your dental provider about that. If the oral microbiome is in eubiosis, there is less inflammation, right? So that's a good thing, right? Sometimes inflammation, when it's on and off because it's fixed the problem, is good. But if there's dysbiosis, which is the opposite of that, there might be some more inflammation happening. We know inflammation is not always a good thing. And part of that is because the immune system is responsible for sending out and controlling inflammation. And if the immune system is constantly working, it starts to tire out a little bit. So with less inflammation, there's less likely of a chance that the undesired microbes travel to other parts of our body. So the idea here is that like if our oral cavity is inflamed, there might be like a little bit of wiggle room for those pathogenic microbes to travel, to get out of the oral microbiome, to travel systemically to the rest of our body. And that's where maybe it's causing some other issues in the body. If you're looking to address your gut health specifically, right? So, because I think that's sort of like what the question was asking, like, is this helpful for gut health? I would say like we know that there's some indications and just as high level of evidence where there are some specific probiotic strains that are beneficial for some gut-related conditions. Okay, so I would say think about that. Don't necessarily rely on treating your oral microbiome for a gut-related thing, right? When we know we can go right to the gut, hopefully I'm explaining that okay too. And I'm going to share that resource with you at the end. And I think it makes sense to integrate, right? Always integrate, like, what else can we do? Because I think in the end, we're going to learn that that's really the key for optimally dealing and managing with some of our conditions. So if we think about eating a diverse array of whole plant foods and having some fermented choices regularly, that's going to give us our pre and probiotics and really balance out what we're doing. So, and also too, all my dental provider would be so proud. We want to regularly brush, floss. We're going to monitor our tongue coating. I think that had something to do with the influence in terms of the pathogens or the U and dysbiosis in the oral cavity. Absolutely get regular dental checkups, right? Professional dental care and treatment for periodontal disease. It's very crucial, right, in order to manage oral health, but also probably now we know systemic health. Really cool. But again, a holistic approach is best. So think besides that healthy diet, how can we manage our stress? Really important for us. And smoking, obviously, and drinking alcohol, I would say, probably disrupts the oral microbiome. Stay tuned. Information is evolving. Maybe it'll be an Ask the Dietitian a year from now. All right, so resources and recipes to share. One of my favorite resources about pre and probiotics, where I got those definitions, but really consumer-friendly content, is the International Scientific Association for Probiotics and Prebiotics. Love it. They talk all about fermented foods. They talk about the prebiotics that are added to foods, what constitutes a probiotic. It's really, really one-stop shop, everything that you might need to know about pre and probiotics. One of my favorite resources as a dietitian to use is the US Adult Probiotic Guide. That link right there will bring you to their website, and it just lists the different products that are available. So it names names, and it goes through the levels of evidence from 1 to 3. So 1 is the strongest, 3, and there's some research there, right, but not as strong. And then the conditions that those strains of probiotics are beneficial for, and it actually cites the research studies specifically. So I like that because if you want to do your homework and you're interested in a product for a specific condition, you could find one. And then you can go to your healthcare provider and say, I found this and I wonder, could this be helpful for me? And that can help you guide decisions in a really more specific way. Some of the people I work with really struggle with IBS. IBS is really highly prevalent, and I just think about that as it relates to gut health. And there's a fantastic dietitian, Kate Scarlatta. She has really, really cornered this area of nutrition in helping people really manage their IBS. So if you're curious to learn more about that, she has a really fantastic website too. I don't know her. I wish I did. I think she's does good stuff. Here's some recipes that I was trying to think of, like seasonal options, for this time of the year that provide both pre and probiotics in the diet, right? Of course, the dietitian is going to be happy about that. The one on the bottom left corner is Yoast. Have you heard about that? So it's yogurt toast. And there's so many different ways that you can sort of like doctor it up. You can go sweet and go savory, but it's a great way to get like both the pre and the probiotics in one-stop shop in your meals, and in a delicious way too. And our next Ask the Dietitian is set for December 6th, our last one for the year, and we're going to appropriately explore a topic that will be helpful for this time of year, all about stress and also emotional eating. So if you're interested in that, please do register, submit your questions. I love to try to answer them. I'm always so grateful to be able to provide this program and to see you all on the first and maybe the second Friday of the month. I'm going to stop my share here